So what happens is if it's after hours, the patient calls the office, answering service gets a hold of their doctor, and then we get connected. And then we talk. And then this is the modern era. So if I can ask patients to send me some pictures. We can connect through FaceTime. If we need to, if we have to do a Zoom or something right away for us to be able to take a look, we have, of course, the keys to the office, right? So if it's 3 a.m. and I really need to come and see the patient, we'll meet here. We don't have to go through the ER or anything like that if the situation is not that alarming, but we can just see each other over here, evaluate, take the dressings down, make sure that everything's good. And even, God forbids, you need to perform some surgery. We have the mechanism. We have our operating rooms, Quad A accredited, real deal operating rooms. And we always have an anesthesiologist on call, and then we can perform surgery right away.
I think it's always good to think about, okay, if something goes wrong, what happens? 98% of the time, things are not going to go wrong. But to me, as a consumer, I'd want to be reassured that, just in case.
Right.
What's going to happen? What does that look like?
Right.
And even let's say something came up and you happen to be on some wonderful wine tour in France.
There you go.
Dr. Salazar, or at a Formula One race. What would happen if you're out of town and something needs to happen?
So normally, and here's what normally would happen with other plastic surgeons, solo plastic surgeon practices. What would normally happen is if the doctor is out of town for any reason, he will ask another doctor from another office to cover for him, right? And again, to the benefit of our patients, if we happen to be on vacation, if we have to go to a national meeting, if we go to a state meeting, and if we have to leave town, the patient will be taken care of, number one, by the same office. All the nursing staff that she is familiar with or that he is familiar with are here. The same medical chart, the same electronic medical record, right? All your information is here. Most likely the same anesthesiologist or one or two of the anesthesiologists already took care of you. And then you have, of course, if one of us is out of town, then you have 4 to 5 other potential physicians that will be covering for the guy or the girl that's out of town. So then you will be very well taken care of.
Yeah. And having that familiarity with, the staff around the patient
makes a big
they're
difference.
not going to be gone necessarily at the same time. And they can also help having that medical record and sharing it with the doctor who's covering.
So again, that care being delivered in a uniform, standardized way